Hi there, this video is about our Haematinics template, which is part of our Pathology Module. Fairly straightforward one, standard kind of options about completing it or appointment being needed. Couple of things just to highlight really. If you're a GP or an AMP, I think the times you're most likely to see this is a scenario a bit like this one. Normally if a patient's folate is under 3, we'd be prescribing folic acid for 4 months, but there are times when the system's picked up that careful review is needed. Doesn't mean it's not at all appropriate, but just need to think through it a bit more carefully. And when that's the case, our system will pick up and display any reasons. And here we can see there's been no B12 result within within the 3 months of the latest folate. And up here I can see there was one done that was in range in April, but the folate's more recent. Now it may be that you choose to still prescribe, and you can use this button here. And it's flagged up this kind of, are you sure you want to proceed? The default here is no. Reviewing first, well, I can show you, we'll just pop out basically this information that I've already looked at. And if now I do want to go ahead, I can click yes, and it will then take me through the next steps. So it will prescribe folate for me, for the patient, for 4 months. Because it's an acute, it can just do that in the background. It will record it all. It will arrange follow-up folate levels in 4 months' time, and it will generate a message to send to the patient. So that one I can ignore because that's just triggered because an auto consult is launched. And in a moment, I think the preset message will appear. What we've deliberately done is where it's not this kind of needs careful review, it just appears on the home screen, and you can action the alert from the home screen. The reason is, as you're kind of seeing, these protocols are quite a lot slower when you run them or launch them from a template, unfortunately. So eventually it's generated the message, and that kind of explains what's what to the patient. But yeah, that's the reason for that. Equally, you may well conclude it's not appropriate, and so you might then put in here, either you've talked to the patient, or it might be no further action, or it might be that you arrange some B12 and kind of go from there. Hope that helps. Yeah, like I said, it's a fairly straightforward pathway at the moment. It may well grow in time. If there's things that you think would be useful to add on, do let us know, and we hope you find it helpful. Thanks.